Good morning, Santa Clarita, and welcome to Aging with Power, sponsored by Comfort Keepers in Home Care, and I'm your host, Myles McNamara, and our show focuses on the challenges and the topics we face on this journey that we call aging. We begin aging from the moment we take our first breath, and although our show will primarily focus on adult and senior issues, we will from time to time visit areas of the entire aging spectrum. From the womb to the tomb, our subject matter experts will address concerns and questions to empower us to make informed decisions. And we're interactive here at Aging with Power, so if you have a question, feel free to call in at 661-298-5487, 661-298-KHTS. We'd love to have you on air to address any questions that you may have, but if you are the shy type, you can just call in and relay your question to our sound engineer, Justin. Say good morning, Justin.
Hello.
Hello, Justin. And he'll give us the question and we'll still address it because preparation is knowledge and knowledge is power. Got a great show lined up for you today. In studio with me is Dr. Anil Sharma, board-certified psychiatrist and clinical pharmacologist with more than 15 years of clinical and research experience. And he's also a faculty member at the prominent institutions of University of California, Los Angeles, Stanford, and VA medical centers. And Dr. Sharma, thank you for joining us on Aging with Power.
Thanks for the invitation.
Absolutely. We're going to address a lot of important topics today. From dementia and Alzheimer's, which is a specialty of Dr. Sharma's, and also he's going to assist in the conversation of my other guest who's flying in as we speak. Returning to Aging with Power is Pam Geyer. She's the manager of the Joint Replacement and Spine Surgery Program and Pain Management Nurse Specialist for Henry Mayo Newhall Hospital. The epidemic that we spoke about in a prior show of how many people are actually addicted to opioids and pain management medications, and kind of off the chart there, and it's been an excellent topic for me as my personal journey has been, being on some pain management programs for the last year. And so Pam Geyer will be joining us momentarily, and it'll be a great discussion. And also Dr. Sharma has expertise in that area as well, helping people to transition from the opioids. And so you've joined us for a great show today. But before we get started, I do have a couple shout outs, as always, that I'd like to say thank you, congratulations, and save the dates kind of things. Been my first time on air since the wine affair. Congratulations to the Seroptimus International of the Greater Santa Clarita Valley for an amazing event a few weeks ago on Town Center Drive. Comfort Keepers was proud to be a sponsor of that. We sipped, we strolled, and we enjoyed the sounds and raised some great funds for the Seroptimus, whose mission is to empower and educate young women, or women of all ages, actually. So that was awesome. And then a couple save the dates for you coming up. I mentioned previously as well, I am chairing once again the Santa Clarita Fun Run Saturday, February 13th at Castaic Lake, and it's a great event, and sponsorships and booths are available. You can call Chris Donald at our Santa Clarita Valley Chamber at 661-702-6977. And a big thank you to Henry Mayo Hospital for picking up our fitness sponsorship. Marley Loffer and the folks over at Henry Mayo have stepped up once again to support not only the community, but the fitness aspect of what this fun run brings to families and people around the valley. So thank you, Henry Mayo. And then again, another save the date for you. It's down the road, but you know what? It's such a busy time of year and such is our annual Celebrity Waiter Dinner that benefits our Santa Clarita Valley Senior Center is, again, fast approaching, one of the best parties in town. It's Saturday, February 27th at the Hyatt this year again. Okay, I'll take a shameless plug again. Comfort Keepers is proud to be the title sponsor for the Celebrity Waiter Dinner, but it's being co-chaired this year by Brian Kegley of Pool and Chaffrey and Peggy Rasmussen of Spirit Properties, and Peggy's also the current president of the Committee on Aging. So sponsorships and tables and such are available for that, so call our Santa Clarita Valley Senior Center at 661-259-9444. If you're not familiar with the Celebrity Waiter Dinner, well, first of all, I'll have to ask you where you've been, but it's an annual party that benefits our senior center, and it's themed. People dress up. It's an amazing event and raises some very important funds for our senior center for the great work that they do over there through their supportive services and case management department. And flying in, as I promised, is Pam Geyer. Welcome, Pam.
Welcome to you too. I just have a quick question on the senior center. Are you going to let it slip what the theme is this year yet?
You know what they told me? Brian told me, and I have to admit that it's usually something very fun and broad. I'm thinking it's like fun and wild. I don't. You know what? I'll have to get back to you on
All
that.
right.
I'm not sure what the theme is this year, but again, mark that date on your calendar, folks. Saturday, February 27th, and you can either call the senior center or myself at Comfort Keepers to give more information regarding that. So we are going to run away for our first break, and when we come back, we will start the process of the information provided by Dr. Sharma and Pam Geyer. We're going to cover a lot of areas with dementia, Alzheimer's, pain management, the addiction therefore, and so don't run away. You're listening to Aging with Power on your hometown station, AM 1220 KHTS. Welcome back to Aging with Power. I'm Myles McNamara on your hometown station, AM 1220 KHTS. And if you're just joining us, today we have in studio Pam Geyer, the manager of the Joint Replacement and Spine Surgery Program and Pain Management Nurse Specialist for Henry Mayo Hospital, along with Dr. Anil Sharma, a board-certified psychiatrist and clinical pharmacologist with more than 15 years of clinical and research experience. And today, the last half of the show, we're going to be talking about dementia and Alzheimer's and Dr. Sharma's expertise in that and his studies. But right now we're going to kick off the show kind of continuing what we've talked about in a prior show as far as America's addiction to opioids and pain management and something that Pam oversees and Dr. Sharma also participates with folks who are in that journey of not only managing their pain management meds, but also when it's time to start to wean off of those meds and the problems that people face. And I know, Pam, you were telling us at the break that you had a pretty successful pain management conference recently. You want to kind of tell us a little bit about that?
Absolutely. Our conference occurred last month, and we had attendance of over 140 professionals. So we marketed to healthcare professionals, physicians, nurses, pharmacists, first responders, the legal realm. Had some dentists that came. Kind of forgot that dentists prescribe opioids too, and the path to becoming dependent, which may lead to an addictive disorder, is so unknown that to include all of those groups was really, I felt really blessed that we had that many voices that were there, and we had phenomenal speakers. As we said before, we had the Department of Justice, the DEA. All of our professional boards from medicine, nursing, pharmacy were present. We even had an attorney expert that talked about licensure defense for those prescribers, because kind of, as we all know, this doesn't change just by one person. This changes both at the provider level, meaning physician prescribing practices have got to change, but then also at the patient and the community level. So we all have to be involved in that. So it was wonderfully successful. Look for the next one in about 3 months. So we're going to offer these every quarter. And so we're going to kind of grow and build on the previous one, and I'm really looking forward. I mean, we had folks from the Westside VA that came, which was very interesting to have that input put into the process, and so very, very good.
And something you touched on, and as patients and the general public out there, you mentioned physician prescribing methods.
Yep.
Are they too footloose and fancy free? Are they just too readily throwing meds at us? I mean, what exactly, when you address that, is the topic include?
Well, I think initially this all kind of birthed in 1995, as I'm sure the doctor here would agree, where we kind of said we weren't effectively managing pain for patients. We were under managing pain because everybody was so fearful of these medications, opioids, and what they would do and the addictive, opportunity that they had. So then out of that, it kind of came this whole generation of, well, pain is what the patient says it is. We gave great numbers to say what your pain is, all in an effort really to be able to help the patient and the healthcare provider manage that pain. But what happened, like most things that we do, sometimes we tend to go too far to one side, and patients, because of the addictive propensity of these medications, did become dependent and develop many addictive disorders on those medications. And so now we've got a group, in our population where, we know if we say a high number, that gets us more medication. Okay, and that's really, we shouldn't be treating numbers. We need to treat patients. We need to make assessments. And we kind of gave up on functionality. And what we realized is that we're really medicating, and you've got a patient population that does not have a functional life. You know, it's the highest cause of unemployment and disability is due to pain or chronic pain conditions. So we needed to look at functionality and what are people doing. So now the pendulum is starting to go the other way. I don't know if you guys have heard it, but I mean, even some of the presidential candidates out there now are talking about this epidemic. And the fear is that we just go too far and we say, no, we're not going to prescribe them anymore. There are conditions that this is very, very appropriate for and utilizing these medications. And we don't want to say that people that have a need, we're not going to treat them. But if you're being treated and you're not getting better, then it comes down to we have to look at what we're doing and change that prescribing pattern to what we can do to help people gain that functionality and have a better quality of life.
And not only on the physical side, but also on the psychiatric and emotional side.
That's true. What happens with opioid medications prescribed, there's a physiological dependence as well as psychological dependence. And in order to treat a person completely, you have to address both issues, not only just physiological, but as well as psychological dependence.
Right, so we're going to peel that onion back a little bit further when we come back for our next break, folks. So don't go away. Don't go away. Don't go away. And we will be right back on Aging with Power on your hometown station, AM 1220 KHTS.